Fantastic question. Here's how therapy literally changes the way your brain functions. It's not magic, it's science. Here we go. So, the point of therapy to help you treat your depression is to help your mood, and we do this by working on the areas of the brain, through talking, and restructuring the way you see the world and your brain functions within it. You might say, that is not possible. But it is. Depression is not just a chemical issue, it's a brain issue. While people talk about the neurotransmitters involved in depression frequently, ACH, serotonin, norepinephrine, dopamine, GABA, etc., there are also brain areas impacted like the amygdala, thalamus, and hippocampus, etc. To top it off, things like genetics, temperament, life events, stressors, also impact these areas, and how they function to impact your mood. Wild, right? There is a lot going on. So, here is the part that will blow your mind. Therapy can literally change the way you function biologically. Some examples with depressed people come from a great study you can find here. Functional neuroimaging studies of the effects of psychotherapy. Yes, they actually looked at brain scans of people before and after therapy. Here's what they found. Know that MDD equals major depressive disorder. SPECT scans and clinical assessments were repeated at 6 weeks. Depressive symptoms decreased significantly after therapy. The decrease in depressive symptoms was associated with increased regional cerebral blood flow, RCBF, in the posterior cingulate cortex and right basal ganglia. Following therapy, MDD participants had metabolic changes in the direction of normalization in these brain regions. Symptomatic improvement was accompanied by significant increases in the left temporal lobe and anterior insula, and significant decreases in the right middle frontal gyrus, including both the ventrolateral PFC (VLPFC) and the dorsolateral PFC (DLPFC), right dorsal caudate, and left middle anterior cingulate cortex (ACC). MDD before and after 16 weeks of treatment with CBT. Response to CBT therapy was associated with increased glucose metabolism in the right inferior occipital cortex, as well as reduced glucose metabolism in the lateral orbitofrontal cortex BA11 and 47, and left dorsomedial PFC BA8. That is why you hire someone who isn't just a paid friend, but a practitioner. This is just one example of studies that are out there, but there are many. Here's another one that looks at how therapy impacts the brain and found this. Cognitive behavioral therapy modified the neural circuits involved in the regulation of negative emotions and fear extinction in judged treatment responders. I mean, it's no joke, right? So while there are a lot of people out there that like to think that therapy is one big sham, it can't do anything, or can't help depression or anxiety because they are chemical issues, I hope this shows you that there is a reason people like me go to years of school. It's a science, and like any other doctor out there, there are people who are amazing at their job and people who are kind of terrible. Do your homework, invest in a great doc, and know that therapy really can make all the difference, even if it's a chemical or brain issue at its core. There's actually a lot more behind therapy than most think. It isn't all Dr. Phil, weird movie psychologists, and terrible talk shows. It's actually a science that can help a lot of people when done properly.